My name is Joan Barr. I'm a registered dietitian and certified diabetes educator at Southwest Health Center. And part of my role at Southwest Health Center is to help people with diabetes.
I'm Sandy Andrews. I'm a registered nurse and a certified diabetes educator at Southwest Health Center. A common myth associated with diabetes is that people with diabetes should eat special foods. That is not true. Actually, we encourage people with type 2 diabetes, as the entire population of people not having diabetes, just to eat a healthy diet, incorporating whole grains, fruits and vegetables, and just making some healthy food choices.
Another myth of diabetes is that if you do have diabetes, you can never eat sugar again, and that would make a lot of people very unhappy. But sugar is metabolized in the body just like any other carbohydrate. So while we do recommend moderation in sugar, we aren't totally eliminating it. For all people, regardless of their risk for diabetes, a healthy diet is a very important part of living and making sure that they maintain their health. And part of a healthy diet means moderate servings, variety of foods, and moderate amounts of sugar. So even if a person doesn't have diabetes, the recommendations for sugar consumption is definitely moderate and keeping it lower than probably a lot of people do.
Another myth is that in the case of somebody that already has diabetes, that eventually, because diabetes is a progressive disease, they may believe that because they need to start insulin, they were bad or didn't do something right, which is also not true. Again, diabetes is progressive. What works today for diabetes management may not be working 1 or 2 years down the road because our body changes. Another myth is that diabetes is a contagious condition, and that is not true. Diabetes is not contagious. It cannot be caught by being next to somebody with diabetes.
It's not very uncommon for the very first reaction to the diagnosis of diabetes to be denial. The patient just doesn't want to hear it, doesn't want to learn anything about it, very resistant to anything that can be taught to them. But over time, just with all stages of change, they eventually realize that yes, this is something I need to manage, and they kind of grasp it and move on with it.
Well, if you think you may have diabetes but don't actually, if you ignore it, think it's going to go away, number one, it's not going to go away. Diabetes is a chronic condition, so if you actually have diabetes and don't get medical attention, the symptoms are going to gradually become more severe over time. I believe that there's statistics out there that when people are actually diagnosed with diabetes, that process has been going on for a period of years in the stage of pre-diabetes, and then the blood sugar becomes high enough to become diagnosed. So if those symptoms aren't treated over time, by the time you're actually diagnosed, in some cases you could already have complications occurring in your nerves and blood vessels that can put you at a higher risk for long-term complications later.
If you suspect that you have diabetes, the best thing to do would be to see your health care provider.